Good morning and welcome to the second day of the 2021 annual meeting for Kentucky Voices for Health. I'm Sheila Schuster. I'm the board chair of KVH, and we are delighted to have you join us from all over Kentucky and perhaps beyond our borders. We are very lucky to have with us a number of legislators from both the House and the Senate who are experts in health and health policy and health issues and have been great advocates to work with over the many years.
I'm just on a webinar now.
So let me go over a couple of housekeeping things. If the participants would keep themselves muted, we would ask that you put any questions for the panel in the chat, and Kara Stewart from KVH will be monitoring the chat, and as questions come up with a particular legislator speaking, we'll go on and try to get those questions in. A number of you also submitted questions in advance, and we're very grateful for that, and we will try to work in those questions as well as we go along, because we would like to make this as meaningful for you as participants as we possibly can. For LCSWs, you can get CE credits for yesterday's meeting if you attended, and also for today's meeting, 2 CE credits. And for community health workers, there is a way for you to get credit for the meeting this morning as well, and Kelly will put that into the chat function. Kelly, I also just heard from Representative Moser that she can't find the Zoom link. Can you send that to her? And I will tell her that it's coming to her LRC email address. Thank you. It wouldn't be Zoom if there weren't these little glitches, right? That's how we know that we're on Zoom. Thank you, Kelly. I would normally be following Emily Beauregard, our erstwhile executive director for KVH, who would be doing this welcome to you. But Emily has lost her voice completely. So she will be on watching us, but I've never heard her be so quiet. So she's always full of good things to say. Let me thank our 2021 sponsors, WellCare, United Healthcare, Humana, and Aetna. Without their support, it would be very difficult to do the kind of work that we've been doing and to have put on this legislative forum for you. So thank you very much to WellCare, United Healthcare, Humana, and Aetna. And I think, Kelly, we can just open up to the panelists and take the slides down. I think those were the only slides we needed to see right now.
Good morning.
Good morning. There, oh, you made it. Great.
I'm so sorry.
That's all right. I'm going to introduce Representative Kim Moser very briefly because she is on an extremely tight time frame, and she's also out in sunny California at a conference. So Representative Moser, House District 64, Campbell and Kenton Counties, chair of the House Health and Family Services Committee. So our question to you, Representative Moser, is what are the things that you're working on that you think are top priority in health for this 2022 session?
Yeah, thank you. I appreciate the opportunity to be here with you, and thanks for working with my tight schedule. So we talk a lot about access to care. We talk a lot about disparities. And so one of my priorities this year is to work on a community health worker bill to make them a Medicaid eligible service and really expand what they can do in helping folks access the care that we know that they now have in terms of insurability and insurance coverage, but why are folks not reaching the healthcare? Why are they not getting the healthcare that they need? And so community health workers have really been shown to help connect folks, understanding social determinants of health and some of the barriers that they face. Another piece of legislation that I'm going to file is lifting prior authorization for healthcare providers who have a high rate of being approved. This will help really remove some of the overhead and high cost that we see in healthcare and expedite the care that folks can get. So those are two of my priority bills. Working a lot on data collection and transparency. I know that Senator Alvarado is probably going to talk about his all payers claims database legislation, and I think that's a really good idea. There are always things to look at in tort reform and the liability protections that our healthcare providers have in Kentucky. We are one of very few states who actually have any protections in place for our healthcare system, our healthcare providers. So those are some of the issues I'd like to look at. Another theme will be in and around our healthcare shortage and healthcare worker shortage, and looking at ways to increase the pipeline and looking at barriers to getting folks into programs. Is it curriculum? Is it, what is it? And just improving those pathways, those, really establishing career pathways for individuals. And this will be part of the community health worker bill as well. So I'm working with KCTCS, and they have a training program in place already, and just ensuring that the certifications and the credits earned will lead to furthering their degrees if they so choose. So, generally speaking, I think that those are some of the priorities I'll be working on. Of course, the cabinet has a lot that they want to work on, so I'll be helping with that.
Yeah. Well, you've touched on a couple of the questions that were submitted by participants. One was, how can we sustainably fund community health workers? So that's something that I know that you're working on. The other had to do with healthcare worker shortages, especially in nursing and in behavioral health. But let me ask you one of the questions, because I know of your great interest in substance use disorders. And one of the questions was, are there any efforts to improve the number and quality of recovery housing? And I don't know whether that's something that, you think might come up in this session, Representative Moser? It's something we've talked about, certainly.
So I do. At last session, we passed Senate Joint Resolution 59, which established a work group to look at a reentry and including housing kind of pay for, or a bundled payment package, perhaps. But so this work group is looking at putting some pilot projects in place to take a look at housing in and out, in and around reentry, and how we how we can best serve the individuals who are suffering with a substance use disorder. and we know that stable housing is a big part of recovery. So we are actually taking a look at that. And while we're on the subject of work groups, we passed House Joint Resolution 57 last year to try to understand what we can do to bridge insurance and really, I think this is turning into more of a discussion around the benefit cliff, and how can states get creative with some of these federal provisions. So we have a very good work group, we are having great conversations, and I know that some of the folks on this call are part of that. So I just want,
that's a legislative cabinet work group, right?
yeah,
Yeah,
you know,
yeah, great.
Yeah.
Dr. Schuster, there's a couple of questions in the chat for Representative Moser. One is for clarity about working to lift prior authorization for healthcare providers with high rates of being approved. Melissa Patrick wanted to have a little bit of follow-up on that.
Sure. So this is a bill that passed in Texas, and it's what it does is establishes a gold card for healthcare providers who are approved at 90% or are approved 90% of the time or higher. And it would just establish that those healthcare providers would not have to go through the prior approval process. So just expedites care to the individuals who are being prescribed either a medication or some diagnostics.
Yeah, we certainly know that prior authorization is a barrier to people getting services many times because of the delay and so forth. Maybe one, I know you're tight on time, maybe one more question, Kara, for Representative Moser.
There's a question from Todd Burris about when you mentioned data transparency, if you would be willing to consider open data laws, such as making publicly available data collected by Kentucky Department of Public Health, Medicaid, publicly available in flat and machine readable files. And he followed up with that to say that there had been a bill in the past addressing open data for health and beyond, and what your level of interest is or knowledge around that.
Yeah, I mean, I think the devil's in the details when we talk about data transparency, and certainly I think that it's important that we have a consistent collection system. First of all, it's really hard to analyze any health data or any data if your measurements, excuse me, are hugely varying. So that's one piece of the all payers claims database. And like I said, Senator Alvarado is going to be able to elaborate on that a little bit more. But the point is to, and I believe that there would be a public and a private section, or the public would be maybe in the form of and maybe this is a long-term goal, kind of a right to shop, so consumers can compare the cost of a procedure, maybe an MRI, for example. So that's one piece of it. It also would create a set of data for patients to access. So not every healthcare provider has consistent EHR, EMR systems. And so the interoperability isn't always there. And I know that this is being worked on outside of simply collecting data, but patients would have their records readily available and be able to take that with them if they needed to. And then there are concerns with the insurers and anti-competitiveness kind of, I mean, there are some details that need to be worked out. Right. But yeah, I mean, I think that the goal is transparency for the public, and then of course data analytics to really assess the high costs of healthcare.
Right. Well, we appreciate your taking the time and working us in this morning and getting up extra early out in the West Coast. So yeah. Thank you very much, and I hope your convention goes very well. We appreciate it.
Thank you so much. Thank you. Have a great meeting.
All right. Thank you. Let me turn now to our friend Senator Julie Raque Adams, representing Senate District 36, which is part of Jefferson County. And Senator Adams is the majority caucus chair, and also during the interim has served as co-chair of the 1915C Home and Community-Based Waiver Task Force. I'm sure you all know that she was formerly the chair of the House Health and Family Services Committee, and then the Senate Health and Welfare Committee. So she comes well prepared. So Senator Adams, I'll ask you the same starting question. What are you looking at in this upcoming session in terms of your priorities and the things that you think will probably be discussed during the session around health policy and health issues?
Sure. Thanks, Sheila, and thank you all for the invitation to be on this panel. This is such a good group, and I think that, the time of it, we have the ability to really delve into these issues a little bit more deeply than some of the other panels that you get asked to participate with. But Kim hit a lot of the high points for what we're anticipating for the 22 session, and that is workforce, 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 workforce. I mean, it's even beyond healthcare. Healthcare is just so critical right now because we just don't have the luxury of taking anybody off the field. And in fact, we have to do a much better job of getting more players on the field. And that goes for, it goes for the urban, suburban areas as well as the rural areas. I mean, we just have such a critical shortfall in access, particularly to primary care. And so, one of the things I've been working on is how do we solve that access problem? I know we need to get more nurses in the pipeline. I know we need to, open up slots so that we can educate more people because of these shortages. But really, we have APRNs right now that are ready to go. And so I'm working on a bill again. I think this will be the third session maybe that we're trying to remove the Kappa CS for APRNs so that they can really help take care of some of those provider shortages in different communities. They can take care of needs that are really critical right now out of this post-pandemic area that we find ourselves in. The other thing too is, we talk about workforce issues, but DCBS, I mean, we have mental health shortfalls. We have social worker shortfalls. And so unless we do a better job of compensating and focusing on those areas where we need to increase reimbursement rates, we're not going to get very far. In fact, we're going to find ourselves in a worse place than we find ourselves now. So we have to focus on increasing those reimbursement rates. Senator Meredith and I were participants, as Sheila mentioned, on the 1915C waiver redesign task force. And it comes down to money. This General Assembly is going to have to dedicate funding in order to keep those nursing home employees, keep those social workers, keep those community mental health providers, keep those doctors and nurses. And so it's going to take dollars. It's going to take a commitment, and that's hard when that is a reoccurring expense. But we need to make a commitment, and so I'm committed to following through on that. Thanks, Sheila.
Thank you. Let me just explain, if people don't know what the 1915C or home and community-based waivers are, but those are a series of 6 waivers that for Medicaid recipients for special populations, and they cover people with significant developmental and intellectual disabilities, with acquired brain injury, and with physical disabilities. And they essentially keep people in the community. So I think one of the issues, Senator Adams, is what would Kentucky be paying for these people to be in institutions or in nursing homes or in intermediate care facilities if we couldn't keep them in the community? And that cost is 4 to 5 times more a day for these folks. And we know that these waivers have huge waiting lists. So it is really a significant problem. And I'm so glad that you and Senator Meredith both have been on that. I think this is your second interim actually on that same issue, right? But we're coming into a budget session. So, we haven't funded any new slots in any of those waivers for a couple of years.
Yeah, and the pandemic really has, thrown everybody for a loop, because the new normal for minimum wage is very different this year than it was 2 years ago. And so
Right.
if you look even back 2 years ago, we were underfunding and under reimbursing those workers who really take care of our most vulnerable. I mean, there's just no other way to say it. It is a tough job. It's emotionally draining, it's physically draining, and we want to find the best people we can to take care of those loved ones. And so we were reimbursing at a paltry rate a couple of years ago. Now, fast forward, we're in a whole different economic ball game as far as minimum wage and livable wages,
Right.
rising inflation. So we've got to make that commitment.
Yeah. Thank you so much. We'll come back around to you, but we appreciate that. Let me go back over to the House and to Representative Danny Bentley, who represents House District 98, Boyd and Greenup counties. Representative Bentley is the chair of the Budget Review Subcommittee on Human Resources and Family Services, a member of the House and Health and Family Services Committee, and was co-chair of an interim committee that I had a great interest in, and that is one on severe mental illness. So welcome, Representative Bentley. We're glad to have you. And let me start out again asking you what your priorities are going to be coming into this session.
You know, this morning, I'm still a practicing pharmacist. I had a lady call me with a hemoglobin of 6.5, no family, and there's a blood shortage up here. So I've tried 3 states to get her a pound of blood, and I can't find any yet. So
Wow.
That's how fragmented our healthcare is right now, before I start. Anyway, one of my priorities, again, will be the Global Opioid Trust Fund. The commission has been set. I'm the only legislator on that commission, and we'll meet next year. I've pre-filed a bill which will try to get to all the companies before they go bankrupt. So it'll be one I'll really be pushing early to get through. Second is, of course, everybody knows that diabetes is close to my heart because I have it. And we've already passed Kevin's law. And on January 1st of this year, there'll be a 30-day supply for $30 so people qualify for that. So the 2 new bills, one will be on medical supplies to reduce and cap that. And the other one is Alex's bill. So this is the people we left out of Kevin's law. So it'll be presented too. And it's interesting because farmers already called me. I'm already getting my pushback on that one. I thought about some things, and one of my bills I've already pre-filed is DNA theft. Thinking out of the box. After watching the James Bond film, I thought we need to protect Kentuckians from DNA theft. Now, some people think that's kind of out there, and they'll ask me what questions, how come we need to have that? There's many, many reasons, and there's a white paper published by Boston University. It's about 20 pages long. So I'll get in more into that later on, but I think that's good if we can get that through this year to protect people. DNA being used against them or being blackmailed or whatever. So that's a new idea that I came up with. From the Severe Mental Health Task Force, we came up with a lot of ideas. I've written one bill, which I won't disclose at this time because I don't need the pushback right now until after Christmas. But we're working on a lot of different things there from, let me think about it. KRS 202A. We're going to amend it. There'll be some amending on that where the word examined will be made into evaluated, hopefully. And the notices from the healthcare workers getting back to the court to speed that up. If you're a professional and you do the evaluation, you get back in 72 hours or 6 days from the exam. So those will be ways that we'll be amending KRS 202A. And we're going to expand the class with 202A also. We're going to encourage the health HMS on PAs for behavioral health. So that's a little faster process, which Chair Lady Moser was talking about on PAs. One of my interesting things that I really like is LAIs, long-acting injectable medications, antipsychotics. And, you know, Kentucky rates about 18% of their patients. For most of the people in the country, about 80%. And I think that would really help us because it makes more compliance. That's always the big thing in medication, where you don't have compliance, plus you have better outcomes. Also, we were working on mental health courts to try to establish more of them.
Right.
And I can't forget Tim's Law. Of course, AOT is assisted outpatient treatment, trying to encourage more of that. And we all know the bottom line is for Medicaid to give waivers for housing, care, and support. So that's an outline of basically what we went through. I'm sure Dr. Willner, Representative Willner, will include some things here in a minute. She was a great help being a psychologist. And what's something else I had? Oh, I'm a big endorser of the nurse practitioners. We have places up here in Eastern Kentucky where if I didn't have a nurse practitioner, I probably wouldn't have any help. So I know some of them see as many as 5,000 people. And if we're going to change that paradigm, like Senator Adams was talking about, then we should start and change the whole paradigm. I got a couple more thing, I think.
Well, you've done your homework. We appreciate that.
One more thing. Oh yeah, on opioid rehabilitation. We're getting ready to open a hospital up this month, which will have a psychiatric hospital and a detox center in it for Eastern Kentucky and a residential residence. Since the global settlement is probably close to $1 billion now, all that money has to be spent in Kentucky. And of course, everybody knows that we had over 100,000 people die from that crisis, and Kentucky's up about 55%. So that's a big concern of mine too, being a pharmacologist, and understand there's more to it than the pharmacology of it. So that's mine in a nutshell. Maybe there's too much to bite into. I got a few more things, but I'm not going to mention them.
There is a lot there, and we will give you a chance to answer a few questions about that when we come back around. We appreciate that.
Okay.
And certainly appreciate your co-chairing the SMI task force. Let me go back over to the Senate and introduce Senator Stephen Meredith, who represents Senate District 5, Breckenridge, Edmondson, Grayson, Hart, LaRue, and Meade counties, co-chair of the Medicaid Oversight and Advisory Committee, chair of the Budget Review on Human Resources, and was also a member of the SMI task force, and I believe also the 1915C task force. So Senator Meredith, we're really glad to have you, and the floor is yours. What are your priorities coming into this session?
Well, I don't think we're going to have a shortage of any bills to consider this session. You know, on the average, we pass between 150 and 200 bills per session, but we'll have close to 1,000 bills that'll be filed this time. And I don't know that I'm going to have any specific legislation that I'm going to present. Certainly, I like a lot of the ideas that my fellow legislators have presented and want to be very supportive of that. I think my role during this session is going to be what I would probably claim as being a villainous protagonist when it comes to our budget. You know, this is the budget session, and COVID has done a lot of things over the last couple of years, but one of the most prominent, I think, is exposing the weaknesses in Kentucky in so many different areas. I think it's similar to having a tornado come through your community. You can't wait for it to get out, but once it's gone, then you got to deal with the aftermath. And I think that's one of the things that COVID has done, is expose the weaknesses that we have in Kentucky across the board. And being the co-chair along with Representative Bentley on the Budget Review for Human Services, I can't begin to tell you the fiscal ask that we have had from people, everyone who has testified. And that's just not healthcare, you know, such as our state police. We're supposed to have 1,200 state police on the highways, and we have 800. It's been that way for some time. So every branch of services is experiencing the same shortfall. And that's got to change. You know, it's not about the money, but it's about the money. And we know there's a shortfall. And I've been advocating almost in every committee meeting that our tax structure presently, it's not fair. We've got 50% of our income that's not, that's been exempted from taxation. And with now almost 45% of our working age adults not in the labor force, we have a very, very small percentage of our population in Kentucky that's carrying the full financial burden. And that's the working people of this state. We have to have more revenue. And I think that's has to come from tax reform. Obviously, that's got to start on the House side, and I keep advocating that we need to do that. But particularly for healthcare, hope to be a voice to make sure that healthcare gets its fair share of our budget. But I'm concerned about that as well. You know, when I came to the Senate in 2016, 17 was my first session, our Medicaid budget was $10 billion at that time. And for this next budget cycle, it's going to be $15 billion. But the Department of Medicaid has already said that their new budget doesn't really include any payment enhancements for anyone. So how are we going to address that? We know it's a crisis situation. You know, when Winston Churchill said that you can always count on America to do the right thing once we've exhausted all other possibilities. A little twist on that for Kentucky. I think you can always count on us to do the right thing after a crisis has developed. And that seems to be our standard operating procedure, is to respond to a crisis, and it shouldn't be that way. We had to fundamentally change the way that we generate revenue in Kentucky, and we have to do that in order to ensure even the basic services that the state has to offer. I don't think people understand how bad it is going to be. Our chairman of our Appropriation Revenue Committee, Senator Daniels, has said that we've already spent probably 2 to 3 times our budget in terms of the commitments that people have asked for. So again, my focus during this legislative session is going to be trying to be an advocate for increasing our revenue stream, having a fair tax code, but also making sure that healthcare providers are being paid fairly and equitably before we have a crisis, which is already at hand. I think it's fair to say that, and particularly for rural Kentucky. And you know that I've been an advocate for rural healthcare ever since I came to the state, not by design, more by accident, even though I've got a healthcare background. But that's the very foundation of our economies in our rural communities, and we're struggling mightily, particularly as a result of this COVID. Again, we have supposedly what's a strong economy, but it's not that way in rural Kentucky. And those workforce issues that we have to address are even more pronounced in rural Kentucky. And so we've got to really focus on those efforts. So again, what I hope to do is lend my voice and my expertise to addressing these payment inequities, revenue generation, workforce development. That's what we have to do almost immediately.
I appreciate that. Do you see the funding as being, at least in part, an answer to the healthcare workforce shortages?
Almost certainly is. You know, we're in competition with everybody in the world for workers. And I think a lot of the reasons people are not looking to go into healthcare any longer is because of the salaries. It's so disproportionate for healthcare providers. And this is a crisis that's been building for several years. I think I said in committee meeting when the Kentucky Hospital Association and Kentucky Nurses Association testified about the current shortage of nurses, that COVID didn't create this. It just pushed it off the cliff. It's been there for several years. There's been peaks and valleys to it, but it's probably the deepest hole I've seen since I've been in the Senate and in healthcare. It's going to be very difficult to recover. You know, other states are taking the initiative to try to work around that. I saw had an article that a hospital in Boston is utilizing robots to replace duties that nurses are performing. Well, you know, that's maybe a stopgap, but that's not a solution to the problem. And that's what frustrates me so much about state government is we always work on treating the symptoms rather than curing the disease. And the disease is a lack of revenue to even address the most basic services for our state.
Yeah, I think the chronic shortage is something that you heard on the SMI task force as well, around the shortages of psychiatrists, child psychiatrists, prescribing APRNs, and then psychology, social work, and so forth. So thank you very much. You're always the voice, certainly of rural healthcare, and I think that's a voice that needs to be heard, and certainly of fiscal responsibility. You know, where are the cost savings going to come, and show me where the money is, and you do a good job of that. So thank you. Let's go back over to. I'm sorry.
Well, I've always taken the position that we need to spend our dollars wisely. We spend a lot of money for healthcare in Kentucky and the United States. And is there enough? I think that's a different argument, but I don't think we spend it as effectively and efficiently as we should. And one of the things I have been working on, but won't have legislation for this time, is kind of a redesign of our delivery model. I don't support the managed care model. I think there's a better way to do it. There's a lot of shortfalls from that model that we refuse to recognize, but that's probably for the 2023 session.
Yeah, and we might have time to come back and hear some of your views. I know you had some excellent testimony in the last MOAC meeting, so thank you, sir. Let me go back over to the House to my fellow psychologist, Representative Lisa Willner, who represents House District 35, part of Jefferson County, and is a member of the House Health and Family Services Committee and A&R Committee, and also was a member of the SMI Task Force. So, Representative Dr. Willner, what are your priorities coming into this session, please?
Well, thank you, Sheila, and thank you, KVH, for including me in this panel. I'm just so struck by how much I'm in agreement with what my colleagues are saying. I'm hearing so much that I think we're all, even though I'm from a different party than everybody else, I feel so much that we're singing from the same songbook here in a lot of ways. And I'm particularly heartened when I hear Senator Meredith talk about the need for more revenue. I have had a proposal in the House that has not been able to get much attention, but would actually generate, the Institute for Taxation and Economic Policy says that this fair taxation policy that I'm proposing would generate about $1 billion a year. And so, Senator Meredith, I'd love to get with you and talk with you about my proposal and see if we have any common ground there. Because there is so much need, and so much of it boils down to having sufficient resources, having sufficient revenue, and investing it in the right way. And I also agree with Senator Meredith. You know, we're treating symptoms all the time. We're trying to put sick people back together, and we're trying to keep people healthy. And if we could move things to the front end, move things further upstream into the prevention arena, I really feel like that's going to serve our state well. And we're going to stop seeing these numbers, Kentucky in the 48th, 49th, 50th place and all these public health measures. And this is something that my colleagues and I speak about all the time. We're tired of Kentucky being in these numbers. And we know we're committed to changing that. And we just need to find the right solutions and get to it. So I really have three areas that I'm focused on right now as far as health policy. One of them is Dr. Bentley did such a great job on the severe mental illness task force. Those folks with severe mental illness represent only 2 to 6% of the population, and that's a fairly stable number across states, across the country, and here in Kentucky, a stable small number, but this is a small number of folks who use and need a tremendous amount of resources. And so staying focused on the task force's recommendations, I'm looking forward to working with Dr. Bentley and others on many of the things that Dr. Bentley already mentioned. So, but I think one of the things to add is to make sure that folks have supported housing, supported employment, in addition to their assisted outpatient treatment, so that they're able to live meaningful, safe lives, and to have to be in a version of recovery from severe mental illness, so that they're able to stay out of the revolving door of emergency room to hospitalization to houselessness. And I feel like the recommendations the task force generated are going to be really helpful, and I look forward to moving those forward. A second area that I'm very passionate about is school mental health. And I have much that I can say about that, but I will say that I think our legislature should be very, very proud of Senate Bill 1 that we passed in 2019, Senate Bill 8 in 2020. Those were the school safety bills, and a significant, from my perspective, the most important piece of the school safety bills was the trauma-informed schools aspect. And it's having trauma-informed, again, and it's about prevention. It's about what do we do on the front end to make sure that students have a sense of belonging, that our schools have a positive and supportive school culture, that we're addressing all students, not just those with the, with the greatest need, but addressing all students from the beginning and creating really safe, psychologically safe spaces for our kids to learn and for our teachers to teach. The trauma-informed schools plans were rolled out this year. What I have heard from a number of folks, not only in schools in Jefferson County, but from schools really across the state, is that the mental health needs with students coming back after the school closures are so high, are so extreme. The adults are traumatized from the amount of trauma they're seeing in students. All of us dealing with 20 months of uncertainty. Are we open? Are we closed? Is there school? Is there not? The amount of stress that creates in individuals and in families and in systems has just been unbelievable. And so even though the trauma-informed school plans are in place, and these really, this would be a proactive mental health professionals embedded into faculty meetings, conversations about what do we look for, how do we recognize trauma? How do we recognize a kid who is asking for help and probably not asking for it directly, but asking for help by acting out? But what's happening, because the need is so great, is these proactive plans aren't really in place. What's happening is that kids are in distress. They're leaving class, talking to the mental health professionals. And thank goodness, again, we should be very proud of ourselves as a legislature that we have funded school mental health as never before. Much more is needed, but we have taken a really big bite out of that. And so many schools have mental health professionals that didn't before, and that's so important. But how we use these professionals in the schools, not just, again, to treat symptoms, but to get ahead of things, is going to be so important. And the third piece, and I feel like I've talked too long already, but the third piece that's so important, I believe, is maternal health. In this country, a woman's possibility of dying in childbirth is double what it was in 1987, and that's nationally. And in Kentucky, we are twice as bad as the national average. And then that disparity gets even worse when we're talking about Black women. So we really have a maternal mortality crisis when it comes to Black mothers. There's a lot that we can do to address these issues. Freestanding birthing centers, currently statute doesn't allow that. And it's, really a non-medicalization or reducing the medicalization of pregnancy. It's such an important issue that we get these freestanding birthing centers in Kentucky. That's a bedrock issue. And from there, we need to expand access to doula care. We need to expand access and funding for midwifery care. There are a number of real things that this legislature can do to address a really scary plight for pregnant people currently in the Commonwealth.
Thank you so much. There were several questions in the chat about maternal health, and I know that I think Representative Rachel Roberts has pre-filed her bill on postpartum depression, which also has a disproportionate impact on mothers of color, lack of education, lack of resources, and so forth. So I think that's another piece of that. You mentioned midwives and doulas and others.
One of the bills we're looking at is a bill that would allow parental depression screenings as part of child welfare visits. Other states are doing that with tremendous results. So even if the parent does not have a primary care physician, but they're taking their child to the pediatrician, they'd be able to get those screenings. So that would be an important and really simple step that we could take.
Great, thank you very much. Senator Karen Berg was going to try to be on, but she is a physician, as many of you know, and her duties in the ER at U of L have called her to be on duty. So she sends her regrets, and I told her that we were happy that she was providing services, certainly in the ER. One of the themes, and Representative Moser talked about this some, and there have been a number of questions in the chat, and I will open this up to anyone who wants to comment. I think there's a real push from the consumer side toward more transparency in healthcare data, whether that's report cards on hospitals and physician care, whether that's to follow up on Senator Meredith's, how is our money being spent? We know that there are a number of states that recently have created what they call an all-payer claims database, which is both Medicaid and commercial insurance would be a part of that and collect all of that data. Connecticut, Nebraska, New York, Virginia, West Virginia, so some surrounding states. And I wonder who might like to comment on some of those things. And have you heard that from your constituents? I guess is part of the question. Senator Adams?
I'll just speak out real quickly on the all claims payer database. Somebody used this example and I thought it was fantastic. They said, when you're traveling to California, you buy a plane ticket, and sometimes the further out you buy it, the cheaper it is. The closer you buy it to the date you want to leave, the more expensive it is. But you buy the plane ticket, you don't get a bill for the gas that went into the plane. You don't get a bill for the services that the flight attendants provided. You don't get a separate bill from the pilot who flew the plane. You just have one bill. And so imagine a healthcare system of, okay, I need to have, outpatient surgery for you name it. Why aren't you just getting one bill? Why are you getting all of these separate bills? And then you have to negotiate with all these different providers on it. It should be like a plane ticket. I mean, what we accept from our healthcare industry versus what we accept with every other industry that we deal with on a consumer basis is really remarkable. And so I just found that very poignant and very, it gave a lot of clarity to the situation that we find ourselves in healthcare, that nobody really understands what the bill is. And so the more transparency we have on that bill, and Senator Meredith harps on this all the time, it's not the amount of money that's in healthcare, it's how we're spending it. And he's 100% right on that.
Right. Well, and it also leads to what we've known as a real consumer problem around surprise billing. So, the consumer does their homework, picks the hospital that's in their network, picks a surgeon that's in their network, goes in, has the surgery, comes home and finds these bills from the pathologist, the radiologist, the anesthesiologist, over whom they have no control in terms of who they get. But if it happens to be somebody out of network, they get hit with these big bills. So that's another part of that fragmentation. I wonder, thank you for those comments. I wonder if anybody else has any thoughts about, I know there was a presentation at Interim Health and Welfare on the all payer claims database. And maybe Senator Alvarado, who was unable to be with us this morning, is working on that legislation. Is that your understanding, Senator Adams? Is he working on that?
Yes, and I'm sure that your audience knows this, but we just also had the Foundation for a Healthy Kentucky address the Interim Joint Committee for Health and Welfare on this concept also. And so I think that we're starting to build that awareness and that education on this issue.
Yeah, okay, thank you. Senator Meredith, have any thoughts about?
I'll have to admit, I'm not as enthusiastic about this legislation as the other panel members appear to be. In theory, I think it's a good idea, but I'm worried how this could be used and how it could be manipulated. And again, it's one of those things that one size fits all when it doesn't. You know, when we talk about price transparency, I think it could be used to create a worse divide for rural healthcare. You know, such as, let's take a CT scan. You know, the price disparity between what it would cost in a rural hospital compared to a freestanding imaging center is substantial. And strictly from an economic model, you would want to go to a freestanding imaging center. But what does that mean for the rural hospital? Well, the reason that price is so much higher is because we take care of this disproportionate number of Medicare and Medicaid patients that don't pay the cost to begin with. So eventually, trying to apply a free market principle here, if people choose to go to freestanding imaging center, that's great. It probably means you're going to lose your rural hospital because that's another revenue stream that they don't have for them. And I think the insurance companies, it's already been evidenced, they would use this to drive down the prices for reimbursement for rural healthcare providers even more than it is today. Again, I'd like to know that this information is going to be used to truly identify the major healthcare issues in Kentucky and address those things. But I think that's part of the problem is we keep wanting to pass healthcare policy that focuses on payment that doesn't have any impact on improving the health of our population. Now, if the healthcare database is used to truly identify the priorities for healthcare needs, then by all means, I'm all for it, but I don't think it'll be used for that purpose. I think it will just be gathering more data that really won't be used effectively, and we could generate some interest in other areas, which we obviously need to, because we have some major issues. You know, some of the testimony we heard this summer as an example, there's a problem with hepatitis C, particularly in Eastern Kentucky. Well, that's primarily our Medicaid population. If that is a major issue, the MCOs come together to put together a program to address that, which they have. You know, they don't want to reimburse for testing, which they should, and that would help drive down the cost. But currently, the system is not designed to really incentivize the managed care organizations to improve the health of Kentucky, as evidenced by the last 10 years. You know, we've only moved the needle from being 47th in the nation to 44th, even though we spend a lot of dollars on managed care to try to improve upon that. And I don't think that incremental improvement that we have seen is a result of the job they have done. I think it's because we have more people that are covered by the Medicaid program now. So I don't see this database that we want to collect being an effective tool unless we put some very strong parameters on it as to who can access it and how it's going to be used. I'm sorry, in rural Kentucky, price transparency doesn't have the same urgency that you do in an urban area, principally because of the lack of resources. There's no other options to go to.
Right. That's an excellent point. And I wonder, I see that both Nebraska and West Virginia have recently passed legislation to put these in place. It would be very interesting to get back to them as rural states to see what kind of safeguards you know, they've put in place to make sure that that doesn't happen. But appreciate your input on that. Let me go to Dr. Bentley, Representative Bentley, because I think he's going to have to leave us early to take care of this lady who needs blood. But I wanted to ask you, Representative Bentley, to tell us a little bit more about your opioid abatement trust fund. How does that work and what would it be used for? It sounds like a wonderful thing if we're going to have more money to put into opioid treatment, but can you tell us a little bit more about that?
Well, excuse me, we just brought up hepatitis C. If we could put some of that money in Eastern Kentucky, where it's really the highest around places like Hazard, we could reduce hepatitis C. So the commission has never met, but I'm open to any type of recommendations. And that's a good example where we can be spending that money. Now, all that money has to be spent in Kentucky. It doesn't go out of state. And right now, between the cities, counties, and state, it's about $960 million. And if we get these other companies before they go bankrupt, it'll probably be close to $1 billion. So anybody wants to get any input into that, send me any recommendations that you have. Now, not to get off the subject, but I want to back Senator Meredith. The other day, I had a doctor recommend I had a CAT scan. I got a call on the phone, and the person told me that my CAT scan, if I drove to Lexington, would cost about $170. If I stayed up here, it would cost $400. So that's a disparity, see, between rural and going to Lexington. But it cost me 3 hours of time each way. And
Right.
finally, they okayed it to be done up here. But that's Senator Meredith is correct on all that. And now, since we closed Bellefonte, we only have one hospital. And that's the reason I got to leave here early, because I got to take this lady to the emergency room, and I know she's going to be in there 3 hours for they to give her a pint of blood with a hemoglobin of 6.5. She can't already talk. She can't breathe. So she has no family. So the system is fragmented all the way around. And it's a lot different in rural Kentucky than it is in the urban section. So that was one of the things I wanted to talk. And one of the things I forgot to talk about a minute ago on the severe mental illness is rural Kentucky doesn't have enough providers or people to talk to people. So Pathways here in Ashland has a 37 feet type A camper, and they've converted it into a place where you can put a TV screen in it and bring the doctor to the people. I went out with them the first few times, and I had several veterans with PTSD come up to me and say, I won't go to the major corporations, but I'll come to this because I've got that stigma. So if we could get some more of those, and that's one of the things I'm going to advocate for, you can take them out into the rural areas and provide mental health therapy. And you bring that doctor in by, if we ever get broadband and all those, between all those mountains, but we can bring them into it. And I think we can really put a dent in the treatment of mental health in Kentucky. But I'm also, go ahead.
No, I was just going to say, I think they're using some of those mobile clinics to go to the homeless shelters so that it's kind of a traveling clinic. And I understand some of them, Representative Bentley, have a mental health provider at one end of the trailer and a physical health provider, if you will, at the other end. So it's truly integrated care, what we call the no wrong door, it's a one-stop shop. Yeah.
If you look in London, they've used this type of idea for many years, London, England. So I'd like to see that. Philips Solutions provides some of that over there.
Yeah. So your opioid trust fund comes from the settlements with the opioid producers.
Yes, ma'am.
It's Kentucky's share of that money that's coming in, that's funding this trust fund. And then there is a council, and you're one of the members of that
commission.
Commission.
Okay. The commission is prescribed in the law, and we haven't met yet. So that's the reason I'm kind of short on this answer, but I've been giving them suggestions. I don't have any voting power. All I have is suggestions. So if anybody out there has any, I'd be glad to accept them.
So we could send those to you at danny.bentley@lrc.ky.gov, right?
Yes, ma'am. I want to be very transparent and very open on that.
Yeah.
Because that's a crisis we've got to work on too.
Well, while I have you, and while you and Senator Meredith are both talking about rural health, let me ask you about broadband, because one of the things that happened during COVID was the delivery of services, particularly behavioral health services, through telehealth. Well, you have to have some reception, at least a smartphone, but ideally you would have some broadband. So I guess I'm wondering what you're hearing, what the plan is to actually get broadband out to every county in Kentucky.
Go ahead.
Senator Meredith, or go ahead.
Well, certainly, I think one of the best things that came out of our last legislative session is committing funds to getting broadbands in underserved areas. And I think we've got a good start with that. And maybe that's the only positive thing that's come out of COVID is the understanding how important this is, not just in healthcare, but also for education. I think the federal government's going to have to step up even more. I think we will be there, probably not as quickly as we would like it, but certainly that's infrastructure is important to us at this point as roads are. But it's another one of those, I think it will help the situation, but I don't think it's going to resolve all of our healthcare problems in rural Kentucky. And I think we're going to have a real epiphany when it comes to this. And I keep reminding people, we don't spend a lot of time talking about how much it costs us doing nothing. And that cost is substantial. And we have to recognize that. What I advocate for is that I think not just rural healthcare providers, but where there are healthcare deserts, which certainly exist in urban areas as well, that's where your most severe healthcare problems are. Why aren't we paying those providers more money rather than less money? Now, the argument I get is everybody's treated equally. But what we've learned over the last decade is being treated equally is not the same as being treated equitably. And I think that's a problem we face in these areas where we have healthcare manpower shortages. We don't recognize the problems that have been generated over decades that have just made the problem even worse in these deserts. I really think we have to be bold with this and say we're willing to provide healthcare providers, medical underserved areas, greater reimbursement than we have in the past. And I guarantee we will see a return on that investment if we would do that, because we know the most expensive healthcare is treating illnesses, not keeping people healthy. So this takes a real paradigm shift, and I don't see a lot of people embracing this idea, which they should. And that goes back to for managed care organizations again. Our MCOs are really not incentivized to improve the health of their population. When I came to the Senate in 2016, as I said earlier, our budget was $10 billion. Now it's $15 billion. Well, who's benefited from that more than anyone? Well, the MCOs have, because they immediately get at least 11% payment differential there. We know they have to commit 90% to medical loss ratio, but 11%. And I think it's higher than that when you factor in everything else. But why would they be incentivized to improve the health of Kentucky? That's why if we're not going to change the delivery model, we need to change the payment model for managed care organizations to truly incentivize them to improve the health. And when we do that, there's going to be savings, and they should share in that if we do that. But we're not doing that. And we need to have a major shift in our thinking as to how we're going to pay for health care and what the expectations are. Another complaint I have is that there's no accountability at all in Kentucky for healthcare outcomes. And because I think it's everybody's responsibility, then it becomes nobody's responsibility. We need to have almost like a healthcare czar that the buck stops there. And I think possibly our Department of Public Health may be the area that we need to do that. Again, another good thing that has come out of COVID is I think the understanding how important public health is to Kentucky. And I think we could expand the role on that. But I think probably we have, over the years, looked at public health as being just health available to the poor, the indigent, and it shouldn't be. It should be it's one standard of care for everyone, and that should be responsibility of at least one cabinet, one person, and presently it's not. We've advocated that responsibility, and we need to have a change in that. And I think our Department of Public Health and even our local health departments could play a more prominent role in doing this. That again, somebody's got to be responsible for the health of our communities. That's one of the things I do like about that database. If we'll use it to identify the most extreme healthcare problems in Kentucky and systematically address those problems, then that's a good start. But back to your original question about broadband, certainly it's important to rural Kentucky. I think we'll get there, not as quickly as we'd like, but that's not going to solve the long-term problems of healthcare in Kentucky.
My turn.
Yeah. Yes, Representative Bentley.
Well, when we talk about rural hospitals and that care in the rural area, if a rural hospital closes, it will never open again. It will never open again. Somebody will come in and say it doesn't have the grandfather clauses, or it doesn't have a sprinkler system, or the operating rooms are too small, because operating rooms are never big enough. We all know that. So, you know, I have to shout out about myself here a little bit. On the rural hospital bill, you know, we finally gave some money to one of the rural hospitals in Kentucky, and that was $1 million, 1% over 5 years. That'll keep those people in business, because a rural hospital to your community, your doctor's worth about $7 to $8 million in the economy of that community. And the taxes, if you got 300 people paying taxes, that's worth at least $500,000 to that community. So not only you got to improve the care, and I'm 100% behind Senator Meredith and all this stuff. And you got to have that also. So finally, we've got that out there to help. And also maternal, you asked me a minute ago about the Opioid Trust and Dr. Willner. We're talking about maternal. We've got to put some of that money into the from the Opioid Trust into maternal. And we've been successful with that in certain places of Eastern Kentucky. And I'm gonna have to go, but the other thing I want to say is SOARs up in Eastern Kentucky, we've been working on broadband, and it's kind of the way you want to look at it. If you look at it, it's going to increase healthcare, then you get more money. If you're looking at it just for economics, they look the other way. So I think it's sometimes how you look at the problem.
Yeah.
So thank you all for having me here. But I
We
got
appreciate your being on, and we appreciate your taking care of this lady who obviously needs your help. So safe travels with her. Yeah. Yeah. Thank you so much. We appreciate it.
And Dr. Willner, I'm anxious to hear from you too.
You'll be hearing from me.
Okay, thank you very much. Thank you, everybody. If anybody
Well,
has any other questions, just text them to me and I'll be glad to
Yeah.
answer.
Yes, we are going to follow up with some questions. Thank you so much. We appreciate
you
your
all.
time.
Okay.
All right. And
Bye-bye.
I think, Dr. Willner, I've heard you talk about, you know, access or disparities or health provider shortages are not just rural. They also occur in urban areas.
That's exactly right. And Senator Meredith talking about these healthcare deserts. It's very much an urban rural issue. It's something we have in common. And I think it really is an opportunity for rural and urban legislators to work together on these issues, because the folks we represent, many of them are facing very similar kinds of issues, very similar kinds of disparities. And, you know, I represent a portion of Jefferson County, but my interest is in the health of all Kentuckians. And when I was the executive director of the Kentucky Psychological Association, we saw the tremendous need for mental health services in rural areas, and that the providers who were in rural areas, the challenges and the struggles they faced. So I'm very much in sympathy with these issues. So this is not, you know, urban versus rural by any means. This is all of us needing to work together.
Well, and I think, go ahead.
Well, this is, you know, a slightly different, I mean, I'm changing course a little bit here, but in 2018, there was a bill passed that terminates parental rights in cases of neonatal substance abuse cases. And that's, you know, just sort of riffing on what Representative Bentley was talking about in terms of talking about substance use disorder and maternal health. And those are two very highly interconnected issues. And this idea that we're terminating parental rights if a child may be born with again, neonatal substance abuse is actually preventing women from seeking treatment. And we think that we can document that fairly well. And so that's a provision that I would really love to see us repeal. And I would love to work with senators and work with my colleagues in the House to get that provision changed, because what we know is that people need programs like Freedom House, where women with addictions are giving birth to healthy, non-addicted babies with treatment. And we want to encourage pregnant people to seek that treatment, not do things to scare them and threaten them and have them hiding out and end up putting themselves and their babies at much greater risk.
Yeah, I actually went to Manchester, Kentucky last week and saw the Volunteers of America Freedom House extension there. And there's also one in Corbin called Independence House that the Community Mental Health Center runs there. And we have them in Louisville. But I think you're right. We ought to look at that piece of legislation. You know, I do think, agree with Senator Meredith, that COVID has brought public health into the fore. I think people never thought about public health except, as you mentioned, Senator Meredith, maybe people without insurance getting some health services. We also know that restaurants have those things on the front that say you have an A grade or a B grade. And if you look at it, that's a health department function. But if you think about social determinants of health and you think about early intervention and prevention, that's public health. The other area that has gotten so much attention with COVID is mental health and substance use, the increase in crisis calls and so forth, which leads me to a question that was put in by one of the participants, and that is, have you all heard about and would you be supportive of funding the 988 suicide prevention mental health crisis line that is going to be rolled out nationally in July, but we will need funding to make sure that it operates and that the crisis call centers operate. So I'm curious if you all have heard anything about it and what your thoughts are about it.
I haven't heard anything about it. When I kind of read through the list of questions that was going to be asked, I was a little confused. But I'm always open, particularly when it comes to any sort of suicide prevention, because I mean, I've watched my own kids struggle during this pandemic with, mental health issues. It's a sad time for everybody, and there's just a lot of anxiety, and so I would love to learn more about it and be open to it.
Well, there's been Senator Meredith, have you heard anything about it?
I have, and but the hot point issue of this is funding again, and we're going to have to make some tough decisions about how we're going to spend these healthcare dollars. It certainly is consistent with my philosophy that if we do this, it generates a return on investment, meaning you got dollars for other places. But it's like throwing Jello up against the wall to see what sticks. There's so many needs. As where do we start? And go back to the discussion about the database. I mean, maybe that helps put that in perspective. But if we could just tackle the top 5 healthcare issues in Kentucky and make a dent in that, then that frees up funds for other services like this, and it's desperately needed. I met with a group of middle school students a couple of weeks ago. They wanted to know about the legislative process, and we talked about the budget, and they recognize there's not enough money out there. So they said, how do you establish priorities? That's a great question, and I'm not sure I've got an answer for that, unless it's whoever screams the loudest and the longest gets the money, but that's not a good solution to that either. You've heard me preach time and time again, with $15 billion in the Medicaid program, that should be enough money to take care of everybody's needs if we spend it the right way. We talk about the social determinants of health, knowing 67% of healthcare problems are based on that. But when we talk about solutions, we say there's no money. There is money. We've got $15 billion in the Medicaid program. It's just how we're spending it. We've got to turn this whole payment pyramid upside down and invest those funds in those social determinants first. That'll reduce healthcare costs, still allow everybody to get fair and equitable payments for their services. But quite truthfully, we have too many services, or the utilization of services too high because we don't take care of our health. So again, I think that the particular initiative is a good one. Would like to see it, but I don't know where the funding is going to come from.
Well, actually, this is came out of the Trump administration. It was one of the few bills that ever passed unanimously in Congress from House and Senate to set up a 988 suicide prevention mental health crisis line. And as I say, it will be rolled out in mid-July of 2022. The funding would be, the proposal is to do the funding here in Kentucky in a parallel way to the way that 911 is funded. And that is by a fee on mobile phone lines. So there would be a 70-cent per month fee for every mobile phone line in the Commonwealth, just as there is a fee to support 911. What's happened is that your community mental health centers that, you know, provide services in every county have been staffing these crisis lines, and there are, and somebody put in the chat, you need to be careful there's not a proliferation of hotlines, and that's exactly been the problem. You know, we've put out numbers for suicide prevention, and then we have separate numbers for veterans or for LGBTQ, for other kinds of crisis. So 988 would bring all of those together, just like 911 brought together all of the emergency police, fire, EMS calls in one line. So Mental Health America and the American Foundation for Suicide Prevention have brought together a number of people. So we will be coming and talking with you about this. We're not asking for you know, necessarily a budget allocation per se, but to educate Kentuckians that for less than $10 a year, they can have this service. And at a time when mental health and crisis services around SUD are so high, we think that the timing is good. So I don't know, Representative Willner, if you had heard anything about it or not.
Only that it's coming and that it's needed, but beyond that, no. In fact, I just learned a lot from you, Sheila.
Okay, well, we will be talking with you all. There's a whole group of folks that are working on this, and I do think it makes sense. We also know that there are mental health crises where people call 911. And what they really need is a mental health response and not the police. So, you know, some of the police departments are sending social workers out to respond to those calls. So this would be a way to kind of differentiate those 911 calls from the 988 calls. The other good thing about this, and Kentucky's way ahead of many of the states because we have a regionalized safety net for behavioral health, is that you will be directed to your local region. So you're not going to be answered by somebody in New York or, you know, somebody in California or even somebody on the other side of the state. If it works the way that we hope it works, you will actually be answered by a live person in the region where you live. So in terms of putting you in touch with resources, they will be very much in your region. So that's the thought behind it. And I think Kentucky, with its regional mental health centers, who are already fielding these calls, are really primed. They're another group of frontline workers that have really been burned out during COVID, as you can imagine. So part of this funding would be to make sure we have adequate staff to staff those call centers and so forth. So we will be coming back to you for sure on that. Let's see, there was a question about, there's been lots of comments and questions about housing, not just recovery housing, but the importance of housing as health is kind of the motto that people are using now. And so I'm thinking if you think about your waiver programs, Senator Adams, Senator Meredith, if you think about your SMI recommendations around the waiver, one of the biggest social determinants of health that is so detrimental to health is houselessness. And we have a growing number of folks. We've been very pleased in KVH to work so closely with Housing Coalition of Kentucky and the various homeless and housing groups and so forth around specific populations. But I think in general, when the economy tanks, and we know from eviction notices and so forth, people stand the risk of losing their housing and the detrimental effect that it has on their health. So that's an issue that I think maybe some of the ARPA funds might be used for that. I don't know what the discussion has been. Senator Adams, if there's been some specific things. I know in Louisville, as you know, because you and Representative Willner and I are all Louisvillians, that a lot of those ARPA funds are being put into housing initiatives, but I didn't know at the state level what was being done.
Yeah, and I think this is one of those issues. I totally agree with you. The return on investment is just significant because if we don't take care of it, we're going to have healthcare costs, we're going to have incarceration costs, we're going to have addiction and recovery costs. I mean, housing is just such a stabilizing force. But I will say that I know it's important, and the people on this call know it's important, but there needs to be some advocacy from the folks around this table to talk to legislators about that issue. Because, you don't really need to talk to me or Steve Meredith, but I think that there's some real education and advocacy that could go on around this housing issue, because it's just so foundational to so many other problems that we find ourselves having to tackle.
Mm-hmm. Yeah, I think you're absolutely.
The money's there, the money's going to go somewhere. And so there has to be some advocacy behind a kind of a grassroots approach to this is really important. I did hear some feedback on how the mayor has handled the ARPA dollars relative to homelessness in Louisville. And there's been a lot of conversations that it probably wasn't the right direction to go. A tent city is not an ideal solution for people who are experiencing these issues. And so if we didn't do it quite right in Louisville, let's get this community around so that we can do it right at the state level. Is just my charge.
Yeah, well, I think it's well stated. I wonder, Kara and Kelly, if we might allow some of our participants to ask questions directly at this point. If anyone wants to ask a question or make a comment. I don't know that I can see hands, so what do you think, Kara? What's the best way to do it?
I would say if people just come off mute, then we can see that pretty quickly and easily.
Okay. Come on, folks, don't be shy.
Or they can also choose to do the raise hand, and we'll call on you too. There's been a lot of conversation in the chat. There wasn't exactly direct questions, so.
I'm going to just say that I have to hop off in 4 minutes. But before I do, I just wanted to really thank you guys again for having me. I want to give a huge shout out to Senator Adams, who talked about maternal health, and she's just been an enormous champion and has accomplished so much on this issue. And I should have acknowledged that earlier, but I certainly want to acknowledge it before I leave and thank her for that. And also to Senator Meredith, every time I hear you say we need to consider the cost of not doing anything, the cost of doing nothing, it just makes my heart sing. I think that's exactly right. And thank you for continuing to ask that question and raise that issue. And I would like to add my voice to that chorus. So thank you for leading on that. I'm going to hang out for another 3 minutes or so. Thank you.
Thank you for taking time away from your conference. Also out, I hope it's sunny in California.
It's in foggy Santa Monica.
Oh, okay. Kara, do you see anybody with a question or comment? People are being so shy.
I haven't. Well, no, Melissa just came off mute.
Yes, I can't find the raise hand function, so I'm just going to come off mute.
You're fine.
Okay.
I actually had to log off for another meeting for 10 or 15 minutes, so I may have missed this, but earlier in the chat, I had asked about some of the maternal related bills that have been pre-filed, and I wondered what the likelihood of those, moving anywhere was, and whether, what needs to be done to at least get the conversation moving a little bit more in a positive direction. Thank you.
You want to take that, Lisa, real quickly before you leave? Because I know you might have some.
Well, I'm gonna, I think, defer mainly to Senator Adams on this, but just as a practical issue, I am a member of a tiny micro minority party, and so I think I don't have a lot of insider knowledge about what bills are going to move or why and how, but I do think that we've got some really good legislation, including some that has been pre-filed and some that I'm aware is being worked on. And I've got some of those specific issues before, but they're no-brainers. And a lot of them don't even have a price tag attached to them. And I certainly hope that we can just come together in an urban-rural bipartisan way and get some of these bills passed that are going to focus on maternal health, infant health, and maternal mental health.
Thank you. Senator Adams?
Sure, and I'll just add, these are all bills that I pay particular attention to just because, I'm a woman, I'm a mom, and there are areas of healthcare that we can do better in. And so I will follow them, but I always like to tell people that it's one thing to file a bill, it's another thing to work the bill. And so there's a lot of people that file bills and they say, hey, look, this is my issue. And then they never ask the members of the committee if they're going to be a yes vote. So, I mean, every chairman I know says, if I say I would like for you to move my bill, their first answer is, how many votes do you have? Can you pass it out of committee? And so what I like to say to people who are carrying these bills and pre-filed these bills is make sure you work them and let me know if you need any help working them, because, like Lisa said, a lot of these don't even have a cost to them. Some of these are just, we have to put this front and center. But I'm committed to helping work those bills and seeing what we can't do, because like I said, there's no reason that we should be in 39th as far as maternal mortality. I mean, there's no reason for us to be there. We can do better.
Thank you. I had a text from someone who wanted to know particularly about the task force recommendations, SMI and HCBS, and how likely, how optimistic you might be about some of those recommendations moving forward. Senator Adams, I'll go to you first, and then I'll let Senator Meredith talk about both task forces because he's been on both.
Yeah, and it was, at least on the 1915, it was very consistent. The testimony was very consistent, and it was, we have a responsibility to this population, and we don't have workers. And so we have to talk about an influx of some sort of money into that system so that we can change those reimbursement rates. Because it doesn't matter how many slots that you fill if you don't have any workers to take care of those people. So I'm optimistic. You know, the part of the reason we did the 1915C again this year was because we hadn't seen much movement. We needed to move on from the Navigant study. We needed to make the changes. COVID came in and really kind of disrupted any energy behind changing that structure. And so I know the people who are on the task force are really committed to seeing something change. I'm always the optimist. And so I think when we come out with our recommendations here shortly, that we have some things that I think we're going to be very easily implemented. And then there's others that are going to take a little time, but we're committed because, you know, what do they say? What's the definition of insanity? Doing the same thing and expecting different results. I mean, we've got to start changing the direction of how we do these policies and how we care for this population.
Thank you. Senator Meredith?
Well, I'm reminded of one of my first lessons when I came to the Senate in 2017. Senator Adams was my seatmate, and she taught me a lot. Back when I was a hospital CEO, I used to really lament about the fact that we're, you know, filing 900,000 bills every session and not making any progress in the real issues of Kentucky. And I remember my first session, I was screaming and yelling about that to her, and she very calmly reminded me, and it was a great lesson, that, you know, every bill that is filed is important to somebody. And everyone on this phone call or the Zoom meeting today, you know, you have your issues and they're extremely important to you. But I assure you, we've got about 4 million people in the state have other issues that are equally important to them. So it's a process you have to go through. And it does take champions to carry legislation forward. And I think sometimes even the very best bills that are non-controversial, nonpartisan, can take 3 to 5 years to make it to the finish line. I don't think people understand the bandwidth that we had to work with being a part-time legislature. It's very difficult to get bills moving because everybody wants their bill taken care of. But persistence is certainly a valuable asset to us. And I was very pleased with both the task force that we did this time, how quickly I think we came to consensus of what the issues are and what we need to do. So I'm optimistic we can move some of these things forward. But long term, we're still going to have to fight for more revenue for our state to address these issues if we're really going to move the needle. So I'm optimistic as well for this next session that we can move some of these things forward. I don't know how much we can, but it's some great ideas and some common sense approaches, and I think we'll see some progress this time.
Well, I, for one, certainly hope so on both those issues. But as I said to the SMI task force, I've only been working on trying to get a task force in a waiver, particularly for 20 years. So I hope that coming back and working on it is going to be effective. But we certainly appreciate it. I think you're right. There was great congruence among the comments and the input of presenters and of the task force members, at least on the SMI. And I watched most of the HCB and saw that same thing. So I think the advocacy community is doing a better job, or I like to think we are, of coordinating our messages so that you're not getting on the same topic, you know, disparate kinds of and competing messages, but really trying to come together in coalitions and get on the same page on many of these things. So hopefully that's a help to you. Kara, is there anybody else, or shall we let these kind legislators go and we'll turn it over to you to do a little wrap up on behalf of KVH?
I hope y'all heard that as a warning. I'm just going to start talking to you unless you got anything else you'd like to ask our legislators today.
This is Melissa Patrick. I have a quick question if they're just about the appetite of the legislature for the tobacco control, allowing local tobacco control over distribution, sale, and there's another word that goes with that. Is there any appetite for
I
that?
think it's advertising, isn't it,
And
Melissa?
advertising.
Yeah. Senator Meredith or Senator Adams, are you hearing anything? That legislation has been filed a couple of years, and I think the Foundation for a Healthy Kentucky has spearheaded that as well.
I've heard very little during the interim about this particular subject, but again, I think it's one of those, there's so many needs that I don't know that that would be considered a priority. I think there's some other things that we can do that have a more pronounced positive impact on health here in Kentucky. And, you know, that one is another one of those is kind of rural versus urban. And I think it's going to have a hard time getting the attention probably that you want it to have.
Yeah, and I would agree with Steve on this. You know, the being a budget year and everyone interested in dollars, which is going to be, you know, number one issue. You're going to have to, you know, fight. They're going to have to fight to get some airtime on that issue. And so, you know, and we only have so much bandwidth. It's not that I'm not supportive, but I worry about the with all.
Yeah, you all are facing redistricting, probably first thing off the bat, and then the budget always sucks up a lot of the air in the room, certainly during a budget session. Final call for any other questions. Well, join me in thanking Senator Meredith and Senator Adams and our other legislative heroes and heroines for being with us. You certainly are welcome to stay and hear a little bit of a recap just from Kentucky Voices for Health, but we certainly appreciate your time and thank you for joining us.
Thank you. Appreciate the opportunity.
Thank you. Bye.
Bye. And Kara, I'm going to turn it over to you, and I think we have something to come up on the screen. We will send, we'll go through the questions and see if there are some that need to be sent to individual legislators if we didn't get to them. So thank you all very much for your participation. And Kara, it's over to you.
Yeah, thanks for that. We will make sure that we follow up on questions that were in the chat if there's something that we did miss, and I apologize for that. So I hope that most folks that are here know who Kentucky Voices for Health is, that we are a nonpartisan, nonprofit coalition of consumer health advocates. And we are working every day to make sure that real Kentucky Voices for Health are heard across the state and are able to make meaningful change so that we're all able to thrive regardless of, you know, race, place, gender, language, etc. So we have that vision, and that is what guides our work. And we welcome you to join us in any way that you can. You will also get this stuff in an email coming out. And one of the ways that we lift up Voices of Kentuckians is we make videos because it is 2021, and we have learned that that is the way that people like to hear stories, and we have the ability to put that out there. So we have a YouTube channel. Please check it out. I think that our link dropper in chief today, who doesn't have a voice otherwise, is probably going to be blowing you up with some links in the chat. Our director, Emily Beauregard. But so we have lots of stories from different voices. And there's some themes in the stories, but it's a way for us to share and be a part of a community, to know that lots of people are in the same boat you are, or there's someone else who's in a similar situation. You can see yourself in that story. There we go. Emily has put the Story Bank YouTube channel. So here are some more of our stories of folks that have shared with what health in Kentucky means to them and their healthcare access and what it looks like. These are all excellent stories. They're all compelling. And if you know anyone who wants to share their story, we're always open to that. Or if you want to share your story, because everyone in this meeting has a healthcare story. Everyone. Because we all are living, and we all have bodies, and we all have minds and hearts, and we've all interacted with healthcare in our lives. So any of you all are welcome to. We also have a separate cool website that we didn't make, but we're a part of, appalachiansformedicaid.org. pretty straightforward address. Don't have to write that one down. You can probably remember it. And that's got our stories that are from Eastern Kentucky specifically. And then there's folks from some neighboring states that have stories in the Appalachian region. Look at that, links in there anyway. All right, the next slide. So, and then I'm full of invitations today. That's what I'm doing today. I'm inviting you to join us in different ways. And one way that we've started up just this year, it's new, baby growing community of health justice advocates. So our network of health justice advocates, we are building a community to support Kentuckians, to guide us, to guide the folks that work at KVH in what we're doing, and to listen to other voices and make sure that people are regularly looped in, regularly getting the right kind of updates to be able to use their voices most effectively and efficiently, people that are community leaders and have boots on the ground experience. And we're open to lots of different experiences to be members. So if you're interested in joining our network of health justice advocates, let us know. Priscilla in our shop is our leader of our health justice advocate network. And she'll be happy to get in touch with you and do a one-on-one intro and do a explanation of what our options are there. But we're really looking for a way to sort of formalize our network that's already out there, because y'all exist. It's just a matter of bringing you together and making sure that we're all working in shared purpose. So, and another big project that KVH has got going on, which we do with a lot of our partners, some of whom are on this call, is our Notice Improvement Project. And this morning, I looked at this graphic and just stared at it because, do y'all see the difference? So you see the notice on the left and the notice on the right. Anybody see anything different about those? If you, I see Kent just put his hands up. I'm sure he doesn't see anything different. We have been working hours a week, every week, again, with our partners, with the state, to go one by one over hundreds of notices, hundreds upon hundreds of notices. And I am so proud of this work that, again, is done with our Thrive Kentucky Coalition and partners to change the notices to make them clear and easy to read. They're all 6th grade level or below, and that there's clear instructions about what you need to actually do and how to do it, and added color. So the state has been a partner in this, which is fantastic and the only way it could be done. And we also have a study starting with Dr. Jamila Mishner of Cornell University to study the Notice Improvement Project. Right now, we know that we've already seen a 12% reduction in discontinuations because of the Notice Project, but we know that there's a lot more to learn about interacting with folks and making it easy to understand and notice. So there's a study that's going to happen to let us know what works, what doesn't work, to continue to grow and evolve and make even better communication so that people can be better advocates for themselves and understand what's going on in their own benefits, which is a big deal to me because, you know, I was a former legal aid lawyer and people would come in and hand me these stacks of papers and I would look at them as an attorney who's really good at reading strange language things and just stare at them. Like there's a conflict here. You know, I'm like, I read 2 sentences and the sentences are in conflict and I can't help you understand this because it doesn't make sense. So it is near and dear to my heart that folks get things that are easy to read and tell them what they need to know. So in a different study that we've got going on with the same university, also through Cornell and Dr. Mishner, is the social services study. And hopefully you've already read the slide while I was talking, but how exciting is this? This is to listen to people. And if you were here yesterday and you heard Commissioner Marta Miranda-Straub ask, what do people think when you hear DCBS? And just people blew up 300 answers of long waits, you know, all kinds of challenges people have experienced DCBS. Well, one way to fix that is to hear from people what works and what doesn't and what real experiences are, and having data to tell us what are the 3 things that we could change to make it better? What is the smartest ways to change this? So this is an opportunity to do that. And so spread the word, share it with folks, talk about it, put it up in your office if you have an office, you know, put it out on your church bulletin, do whatever you can do because we want to hear from a wide range of voices and experiences to have people participate in this study because the research and the data is only as good as getting the number of people we're able to get to participate. People are paid for the time, and it's a meaningful way to contribute to improving the way that Kentuckians are able to thrive with our safety net and making it stronger in the future. Because I promise that KVH will use the results of the study to make our safety net stronger. And I know our partners will as well. And also a shout out that it's, oh yes, well, you're gonna get this email, and Lisa, to print it off, we can email you directly with a quality social media file and a tear off. I saw Kelly nodding her head, and we can make sure that in the email package that you get from attending this meeting, that you get all of that. So you'll get a link to the video and the slides and that separately. We'll put that one piece on there separately because yeah, we want to get that word out to every place that we can. Something that's not on a slide that Kentucky Voices for Health has been working on is the Midwifery Learning Collaborative, where it is what it sounds like. We are working in collaboration with the state, with providers, with doulas, with other advocates, with insurers, and more to get around the table and get some common language and to understand and to learn what the best practices are. Why do we have so many people dying because they are pregnant and giving birth? Why do we have Black women dying at double the rate of white women? So figuring out what that means and all getting together around the same table to learn together is a powerful experience. And Kentucky Voices for Health is at that table. And if any of you want more information about the Midwifery Learning Collaborative, Christina Libby is our lead for that, or you can reach out to me, because I'm also participating. And then the Kentucky Coalition for Healthy Children, again, this is yet another ask. Just, you figure out where you fit in. Whatever speaks to you and you feel like this is where you need to be, you can show up there. This is led by Amalia at the Foundation for a Healthy Kentucky. And it's a wonderful, diverse group of organizations that are doing some of that same learning and also doing quite a bit to promote policy priorities and get the word out across the different parts of policy that directly affect children, especially through schools. Because sometimes there's a lot of siloing in what is public health, what is healthcare, and what is school policy, and where those intersect. And of course, we have children as captive audiences all day across the state in schools. So we can use that to an advantage to make sure that they're as healthy as possible and getting their needs met. And that is what the Coalition for Healthy Children is focused on. So that's, look at that, the link's there already in the chat, killing it today. And with that, I will turn it over to Kelly Talby to talk about what else is going on.
Yes, and I will be quick here. I know everyone wants to reserve their time and we're short on it. The American Rescue Plan Act passed in March of this year. Kentucky Voices for Health, the Thrive Kentucky Coalition, in partnership with the Cabinet, put together a 6 Ways ARPA Helps Kentuckians explainer and FAQ. This has been widely shared. It is still very relevant on many of its messages and was in fact recently nominated for a Center on Budget National Award. So we hope you will consider please sharing that, using that for yourself or the individuals you serve. It's got a lot of information from housing and healthcare to credits for enrollment in healthcare. It's food assistance, PEBT, SNAP, you name it. How can we help each other? The next slide. The postpartum coverage comment collector. This is an effort we are currently going through. Kentucky has right now 60 days of coverage postpartum, which we all know is not a fair, healthy, honest, accurate depiction of what postpartum needs are. And although it's an option to have 12 months of coverage, Kentucky has still not achieved in securing that coverage for our mothers. So we are still seeking comments. Look in January for an official organized letter to be submitted using Kentucky's comments. Here are a couple examples, very recent examples. One is a current postpartum mother facing many safety net challenges, and exactly what postpartum coverage for a year could mean. So we encourage you to please share this. Please help us get involved, make it a better unified front on why this is so critical for Kentucky's maternal health and postpartum care. Thrive Kentucky. You all hear us often elevate our coalition of partners and our monthly updates, which on a quarterly basis is with the Cabinet for Health and Family Services. Our next monthly update is actually this next Tuesday at 2 p.m. Eastern Time. It's never too late to register. You all know us that we'll roll with you if you want to join us 2 minutes before it's go time. So we hope you'll consider joining us to hear the latest updates on federal legislation and policy, state legislation and policy. We'll look to the legislative 2022 session that we just heard a lot of good information on from our legislators. This is typically an hour-and-a-half forum, and please come with your questions and comments. There's continuing education credits available for both community health workers and social workers as well. Next slide, please. In January, we will be having an amazing Advocacy 101 training from our board chair, Dr. Sheila Schuster, who you heard from today, and our executive director, Emily Beauregard, whose voice will be back on January the 10th. We will be joined by Chairman Hornbeck from the Senate and Representative Willner from the House that you all met today. This is just an effective tool. It might be a refresher for some. It could be a crash course for many just getting started, but we cannot emphasize enough the value of hearing from these power minds on how to effectively advocate for yourself, the organizations you work for, and the work you do with the legislature. Next slide, please. In January, look for us to produce another health justice bill tracker. This is something we did for the 2021 session, and it seemed to be favored. People enjoyed it, used it. We will have a Medicaid issues tracker where we will continue to collect, whether it's a systems issue or not, things happening on the ground so that we can better advocate for those changes moving forward. There will be a No Surprises Act explainer, and I should have mentioned this with the ARPA explainer as well, but Build Back Better, which we know the House has passed and we're waiting on action in the Senate. But should that become a reality, we hope that we can also make a Build Back Better explainer and help elevate the good policies that will come from that act. We will have more videos. This is something, to Kara's point, we always want stories. The cadence, the drumbeat, the more stories we can elevate yours and those in your worlds, it helps our work advocating for you and the Kentuckians in your communities so much easier. So we hope you'll consider subscribing to our newsletter, staying up to date, informed, getting involved, and we just look forward to working with you every single day. And is that the last slide? Thank you to our sponsors. Sheila gave them a shout out early, WellCare, Humana, Aetna, and United Healthcare. We could not have delivered this year's annual meeting to you all for free without their support, and we just value their engagement and efforts on both Thrive Kentucky sponsorships and for our annual meeting this year. We can't do it without them and are very, very grateful for their involvement this year. And with that,
thank you.
I believe
Yes.
that is the last slide.
Thank you to you all for joining us. I'm going to give you the Schuster Rule of Advocacy. You heard from legislators. Drop them a note or send them an email and thank them for their participation. They take their time out to share their thoughts and input and send some really helpful advice. And they're part-time legislators, and it's really nice, as we all know, to be thanked. So that's my advocacy tip for today. And thank you all for your support of Kentucky Voices for Health. You all are Kentucky Voices for Health, and we appreciate you. Thank you so much.